Question 1. The investigation demonstrates a patient presenting with newly erupted first permanent molars. The dental hygienist is considering the application of preventive materials. Which of the following approaches best reflects current evidence-based practice and ethical considerations for this patient? Option A. Apply dental sealants to the occlusal surfaces of the newly erupted molars, provided there is no evidence of frank cavitation, and educate the patient on oral hygiene and the benefits of sealants. Option B. Administer a high-concentration fluoride varnish to the occlusal surfaces of the newly erupted molars, as fluoride is the primary agent for preventing molar caries. Option C. Proceed with sealant placement only if the patient expresses a strong desire for it, prioritizing patient preference above all other clinical considerations. Option D. Recommend a specific brand of fluoride rinse for daily home use, as this is the most cost-effective and universally applicable preventive measure for all patients. The correct answer is A. Apply dental sealants to the occlusal surfaces of the newly erupted molars, provided there is no evidence of frank cavitation, and educate the patient on oral hygiene and the benefits of sealants. Explanation. The investigation demonstrates a common clinical scenario involving the application of preventive materials, specifically dental sealants and fluoride. The challenge lies in selecting the most appropriate preventive strategy based on individual patient risk factors and current evidence-based guidelines, while adhering to the scope of practice and ethical responsibilities of a dental hygienist. This requires a thorough assessment of the patient's oral health status, including caries risk, existing restorations, and oral hygiene habits. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment to determine the most effective preventive intervention. This aligns with the ethical principle of beneficence, ensuring the patient receives care tailored to their specific needs and risk profile. Adherence to evidence-based guidelines, such as those promoted by the American Dental Hygienists Association (NBDHE) and the National Institute for Dental and Craniofacial Research (NIDCR), is paramount. This approach ensures that the chosen preventive material is indicated, applied correctly, and that the patient receives appropriate education for maintenance, thereby maximizing its efficacy and minimizing potential harm. An incorrect approach that relies solely on a blanket application of sealants to all newly erupted molars, without considering the presence of existing caries or the patient's overall caries risk, fails to meet the standard of care. This could lead to unnecessary treatment, potential for trapping existing decay, and a missed opportunity for more targeted preventive measures if the patient has a low caries risk. Ethically, this is a failure of individualized care and potentially violates the principle of non-maleficence if sealants are applied where not indicated. Another incorrect approach, focusing exclusively on fluoride varnish application without assessing the need for or suitability of sealants on susceptible pit and fissure surfaces, represents a failure to consider all available preventive modalities. Fluoride is a crucial preventive agent. It may not be sufficient to protect deep, retentive fissures from bacterial invasion and acid attack. This approach neglects a key preventive strategy for caries in these specific anatomical areas, potentially leading to preventable decay. This is a failure to provide comprehensive preventive care. A third incorrect approach, prioritizing patient preference for a specific material over clinical evidence and professional judgment, is ethically problematic. While patient autonomy is important, it must be balanced with the dental hygienist's professional responsibility to provide care that is clinically indicated and evidence-based. Recommending or applying a material that is not clinically appropriate, even if preferred by the patient, can lead to suboptimal outcomes and potential harm. This is a failure to uphold the professional's duty of care and expertise. Professional decision-making process for similar situations should involve a systematic approach. 1. Thorough patient assessment, including medical history, dental history, caries risk assessment, and clinical examination of teeth and soft tissues. 2. Review of current evidence-based guidelines and best practices for preventive materials. 3. Consideration of the patient's individual needs, risk factors, and potential benefits and risks of each preventive option. 4. Collaborative discussion with the patient, explaining the rationale for recommended interventions and addressing their concerns. 5. Documentation of the assessment findings, treatment plan, and patient education. Question 2. Upon reviewing a patient's head and neck, the dental hygienist palpates a firm, elongated structure deep to the mandible, extending anteriorly from the angle of the jaw. This structure is located medial to the masseter muscle and appears to be a significant landmark for potential local anesthetic administration. Which of the following anatomical structures is most likely being palpated? Option A, facial artery. Option B, submandibular duct. Option C, inferior alveolar nerve. Option D, lingual nerve. The correct answer is C, inferior alveolar nerve. Explanation: scenario analysis. This scenario presents a professional challenge because the dental hygienist must accurately identify and differentiate between anatomical structures of the head and neck that are critical for providing safe and effective patient care. Misidentification can lead to incorrect diagnosis, inappropriate treatment planning, and potential harm to the patient, such as nerve damage or vascular compromise during procedures. The complexity arises from the intricate relationships between muscles, nerves, blood vessels, and bony landmarks in this region. Correct approach analysis. The correct approach involves a systematic and precise identification of the anatomical structures based on their characteristic locations, relationships to other landmarks, and palpation findings. This aligns with the NBDHE emphasis on foundational scientific knowledge, including anatomy, which is essential for clinical competency. Best professional practice dictates that a dental hygienist must possess a thorough understanding of head and neck anatomy to perform assessments, administer local anesthesia, manage oral conditions, and communicate effectively with the dental team. This knowledge is implicitly required by the standards of care and ethical obligations to provide competent and safe patient treatment, as outlined by dental hygiene regulatory bodies. Incorrect approach is analysis. One incorrect approach would be to rely on generalized or superficial knowledge, leading to a vague or inaccurate identification. This fails to meet the standard of care expected of a licensed dental hygienist and could result in diagnostic errors or procedural complications, violating the ethical principle of non-maleficence, do no harm. Another incorrect approach would be to confuse structures with similar appearances or locations, such as mistaking a major artery for a nerve or vice versa. This demonstrates a critical deficiency in anatomical knowledge, directly contravening the educational and licensing requirements for dental hygienists, which mandate a comprehensive understanding of relevant anatomy. A third incorrect approach might involve guessing or assuming the identity of a structure without proper verification, which is unprofessional and potentially dangerous, undermining patient trust and safety. Professional reasoning. Professionals should approach anatomical identification by first recalling the general anatomical region and its key features. Then, they should utilize a combination of visual inspection, palpation, and knowledge of anatomical relationships to narrow down possibilities. If uncertainty remains, consulting anatomical atlases, textbooks, or experienced colleagues is a prudent step. This systematic process ensures accuracy and minimizes the risk of error, upholding the highest standards of patient care and professional responsibility. Question 3. Cost-benefit analysis shows that implementing a comprehensive instrument sterilization and disinfection protocol, including the use of appropriate chemical indicators and regular equipment maintenance, is a critical component of preventing healthcare-associated infections. Considering the regulatory framework for dental hygienists in the United States, which of the following approaches best aligns with these principles when managing reusable dental instruments? Option A. Using disposable instruments for all procedures regardless of the risk of transmission, to eliminate the need for sterilization. Option B. Skipping certain sterilization steps for instruments that appear less contaminated to expedite patient turnover. Option C. Relying on visual inspection of instruments to determine if they are clean enough for reuse, as this saves time and resources. Option D. Implementing a multi-step process that includes thorough cleaning, high-level disinfection or sterilization according to manufacturer instructions and regulatory guidelines, and verification of effectiveness. The correct answer is C. Relying on visual inspection of instruments to determine if they are clean enough for reuse, as this saves time and resources. Explanation. This scenario presents a professional challenge because it requires a dental hygienist to balance the immediate need for infection control with the practicalities of resource allocation and patient flow within a clinic setting. The decision-making process must be grounded in established public health guidelines and professional standards to ensure patient safety and prevent disease transmission. The correct approach represents best professional practice because it prioritizes evidence-based infection control measures that are universally recognized as effective in preventing the transmission of pathogens. Adhering to the CDC's guidelines for infection control, which are the standard in the U.S. healthcare system, and thus relevant to the NBDHE exam, ensures that all necessary steps are taken to minimize risk. This includes proper sterilization, disinfection, and personal protective equipment, PPE use, which are non-negotiable for patient and provider safety. An incorrect approach that relies solely on visual inspection of instruments without following a documented sterilization protocol fails to meet regulatory requirements. The Occupational Safety and Health Administration, OSHA, mandates specific standards for infection control in healthcare settings, which include the proper handling and processing of reusable medical devices. Relying on visual inspection alone is insufficient, as many microorganisms are not visible to the naked eye and can remain infectious. This approach also violates the ethical obligation to provide a safe environment for patients. Another incorrect approach that involves skipping certain steps in the sterilization process to save time or resources is a direct violation of established protocols and regulatory mandates. Such shortcuts can lead to the inadequate inactivation of pathogens, posing a significant risk of cross-contamination and patient harm. This demonstrates a failure to uphold professional responsibility and a disregard for patient well-being, which are core tenets of dental hygiene practice. A third incorrect approach that involves using disposable items for all procedures without considering the cost-effectiveness and waste implications, while seemingly safe, may not be the most efficient or environmentally responsible solution. While disposables offer convenience, a comprehensive risk assessment would also consider the economic impact on the practice and the potential for environmental burden, while still ensuring that all reusable items are properly sterilized. The decision-making process should involve a systematic evaluation of risks and benefits, guided by regulatory requirements and professional judgment, to implement the most effective and appropriate infection control strategies. Question 4. Examination of the data shows a patient presenting with white, cottage cheese-like patches on the tongue and buccal mucosa, accompanied by a history of recent chemotherapy. The patient reports mild discomfort. The oral flora analysis reveals a significant presence of Candida albicans along with commensal bacteria. Which of the following represents the most appropriate initial management strategy based on the patient's presentation and oral microbiology findings? Option A. Advise the patient to maintain meticulous oral hygiene and schedule a follow-up appointment in 2 weeks. Option B. Consult with the dentist to discuss potential antifungal therapy and reinforce oral hygiene practices. Option C. Prescribe a broad-spectrum antibiotic to address any potential secondary bacterial infection. Option D. Recommend the patient rinse with a dilute saline solution and monitor for resolution. The correct answer is D. Recommend the patient rinse with a dilute saline solution and monitor for resolution. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dental hygienist to differentiate between common oral microorganisms and those that pose a significant risk to patient health, particularly in the context of a compromised immune system. Misidentification or underestimation of pathogenic potential can lead to delayed or inappropriate treatment, potentially exacerbating the patient's condition. The hygienist must apply knowledge of oral microbiology within the scope of practice defined by NBDHE regulations, ensuring patient safety and adherence to professional standards. Correct approach analysis. The correct approach involves identifying the predominant microorganisms present and assessing their known pathogenic potential, especially in relation to the patient's immunocompromised status. This aligns with the NBDHE emphasis on evidence-based practice and patient-centered care. By recognizing that Candida albicans can be opportunistic and is more likely to cause infection in an immunocompromised individual, the hygienist can initiate appropriate interventions, such as recommending antifungal therapy or more frequent professional cleanings, in consultation with the dentist. This proactive and informed decision-making process directly supports the ethical obligation to promote patient well-being and prevent harm, as outlined in professional practice guidelines. Incorrect approaches analysis. One incorrect approach would be to dismiss the presence of Candida albicans as normal oral flora without considering the patient's medical history. This fails to acknowledge the opportunistic nature of this fungus and the increased susceptibility of immunocompromised individuals to candidiasis. Ethically, this represents a failure to provide individualized care and a potential breach of the duty of care, as it overlooks a significant risk factor. Regulatory failure lies in not adhering to the principle of comprehensive patient assessment, which includes considering systemic health factors that influence oral conditions. Another incorrect approach would be to immediately prescribe a broad-spectrum antibiotic without confirming a bacterial infection. This is inappropriate because the observed white patches are more indicative of a fungal infection, and antibiotics are ineffective against fungi. Furthermore, unnecessary antibiotic use contributes to antimicrobial resistance, a significant public health concern. This approach demonstrates a lack of diagnostic reasoning and a failure to follow established protocols for managing oral lesions, which could be considered a violation of professional standards and potentially lead to adverse patient outcomes. Professional reasoning. Professionals should approach such situations by first conducting a thorough patient assessment, including a detailed medical history, paying close attention to any conditions that might compromise the immune system. Following this, a comprehensive oral examination should be performed, noting the characteristics of any lesions or abnormal findings. Based on these observations, the hygienist should utilize their knowledge of oral microbiology to hypothesize potential etiologies. Crucially, the hygienist must then consult with the supervising dentist to confirm the diagnosis and develop an appropriate treatment plan. This collaborative and evidence-based approach ensures that patient care is safe, effective, and aligned with regulatory requirements and ethical obligations. Question 5. Performance analysis shows a patient expresses a strong preference for a specific, less evidence-based treatment option for their periodontal maintenance, despite the dental hygienist's professional recommendation for a more clinically proven approach. The dental hygienist has thoroughly explained the rationale for their recommendation and the potential limitations of the patient's preferred method. What is the most appropriate course of action for the dental hygienist? Option A. Terminate the professional relationship immediately due to the patient's noncompliance with professional recommendations. Option B. Proceed with the patient's preferred treatment option without further discussion, respecting their autonomy above all else. Option C. Engage in a detailed discussion with the patient, further explaining the benefits and risks of both treatment options, exploring any underlying reasons for their preference, and collaboratively determining the best course of action within the scope of practice and ethical guidelines. Option D. Inform the patient that their preferred treatment is not acceptable and unilaterally implement the hygienist's recommended treatment. The correct answer is C. Engage in a detailed discussion with the patient, further explaining the benefits and risks of both treatment options, exploring any underlying reasons for their preference, and collaboratively determining the best course of action within the scope of practice and ethical guidelines. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed desire and the dental hygienist's professional obligation to provide care within the scope of practice and ethical guidelines. The hygienist must navigate the patient's autonomy while ensuring the treatment plan is safe, effective, and aligns with established standards of care. Careful judgment is required to balance these competing interests without compromising patient well-being or professional integrity. The correct approach represents best professional practice because it prioritizes patient education and collaborative decision-making within the established scope of practice. By thoroughly explaining the rationale behind the recommended treatment, addressing the patient's concerns, and exploring alternative options that are clinically appropriate, the dental hygienist upholds their ethical duty to inform and empower the patient. This aligns with the principles of informed consent and patient-centered care, which are fundamental to dental hygiene practice as outlined by the NBDHE regulatory framework. An incorrect approach that involves proceeding with the patient's requested treatment despite professional judgment would represent a significant ethical failure. This could lead to suboptimal outcomes, potential harm to the patient, and a breach of the dental hygienist's responsibility to provide evidence-based care. It disregards the professional's expertise and the established standards of practice, potentially violating regulations governing the scope of dental hygiene practice. Another incorrect approach, such as dismissing the patient's concerns and unilaterally deciding on a different course of action without adequate explanation or discussion would be ethically problematic. This undermines patient autonomy and the trust essential in the provider-patient relationship. It fails to meet the ethical obligation to communicate effectively and involve the patient in their own care decisions, potentially violating guidelines on patient rights and communication. A further incorrect approach, such as refusing to provide any treatment and terminating the professional relationship without appropriate referral or justification, could also be ethically unsound. While a hygienist has the right to refuse treatment under certain circumstances, this must be done responsibly, ensuring the patient is not abandoned and understands the implications of such a decision. This could violate professional responsibilities regarding patient care continuity and ethical termination of the professional relationship. The professional decision-making process for similar situations should involve a systematic approach. First, clearly identify the patient's request and the hygienist's professional assessment. Second, thoroughly educate the patient about the recommended treatment, its benefits, risks, and alternatives, and the rationale behind the professional recommendation. Third, actively listen to and address the patient's concerns and values. Fourth, explore all clinically appropriate options that align with the patient's needs and preferences while remaining within the scope of practice and ethical guidelines. Finally, document the discussion and the agreed-upon treatment plan thoroughly. Question 6. Benchmark analysis indicates that dental hygienists are increasingly expected to recognize the oral manifestations of systemic diseases. A patient presents with generalized oral mucosal lesions, fatigue, and unexplained weight loss. The dental hygienist has completed a thorough oral examination and medical history review. Which of the following represents the most appropriate course of action for the dental hygienist in this scenario? Option A. Attempt to diagnose the underlying systemic condition based on the oral lesions and recommend a specific treatment plan. Option B. Initiate a referral to the patient's primary care physician for further medical evaluation. Option C. Refer the patient directly to a specialist, such as an oral surgeon, without consulting a physician. Option D. Advise the patient to increase their intake of vitamins and minerals to address potential deficiencies. The correct answer is B. Initiate a referral to the patient's primary care physician for further medical evaluation. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the ethical and legal obligation to provide comprehensive patient care while navigating the complexities of interprofessional collaboration and scope of practice. A dental hygienist must exercise sound judgment in recognizing when a patient's condition extends beyond their direct scope of practice and requires referral to another healthcare professional. Failure to do so can result in delayed or inadequate treatment, potentially harming the patient and violating professional standards. Correct approach analysis. The correct approach exemplifies best professional practice by prioritizing patient well-being and adhering to the established regulatory framework for dental hygiene, recognizing the limitations of one's own expertise, and initiating a timely referral to a physician for a suspected systemic condition aligns with the dental hygienist's ethical duty to act in the patient's best interest and within the defined scope of practice. This demonstrates a commitment to patient safety and the collaborative nature of healthcare, ensuring the patient receives appropriate diagnosis and management for their condition. This approach is supported by the NBDHE emphasis on patient assessment, diagnosis, and referral as core competencies. Incorrect approaches analysis. One incorrect approach involves attempting to manage the suspected systemic condition without consulting a physician. This is a significant regulatory and ethical failure because it exceeds the dental hygienist's scope of practice, which is defined by state dental practice acts and professional guidelines. Such an action could lead to misdiagnosis, delayed treatment of a serious underlying condition, and potential harm to the patient. It also violates the principle of professional accountability and the duty to refer when necessary. Another incorrect approach is to dismiss the patient's symptoms as unrelated to any systemic issue without further investigation or consultation. This demonstrates a failure in patient assessment and a lack of due diligence. It overlooks the interconnectedness of oral health and systemic health, a fundamental concept in dental hygiene. Ethically, it breaches the duty of care by not adequately exploring potential health concerns that could impact the patient's overall well-being. Legally, It could be construed as negligence if the condition worsens due to lack of timely referral. A third incorrect approach is to refer the patient to a specialist without first consulting a physician. While specialist referrals are often appropriate, in cases of suspected systemic illness, the initial step should be to involve the patient's primary care physician. This ensures a coordinated approach to diagnosis and management, preventing fragmentation of care and potential miscommunication between healthcare providers. It also respects the physician's role as the central point of contact for systemic health concerns. Professional reasoning. Professionals should employ a systematic decision-making process that begins with thorough patient assessment, including a comprehensive medical history and oral examination. When signs or symptoms suggest a condition beyond the scope of dental hygiene practice, the professional should consult relevant literature, establish protocols, and if necessary, colleagues or supervisors. The paramount consideration is always the patient's safety and well-being. If a referral is indicated, the professional must ensure it is to the most appropriate healthcare provider, and that clear communication is established to facilitate continuity of care. This process is guided by ethical principles, legal statutes, and professional standards of care. Question 7. Analysis of a patient presenting with gingivitis and a history of uncontrolled hypertension requires the dental hygienist to consider potential systemic influences on oral health. Which of the following approaches best reflects a comprehensive risk assessment and professional responsibility in this situation? Option A. Proceed with standard periodontal debridement, as hypertension does not directly contraindicate routine dental hygiene procedures. Option B. Conduct a thorough oral assessment. Review the patient's medical history for any specific contraindications or precautions related to hypertension, and consult with the patient's physician if necessary to ensure safe and effective treatment. Option C. Delay all dental hygiene treatment until the patient's hypertension is fully controlled, as any stress from dental procedures could dangerously elevate blood pressure. Option D. Recommend immediate referral to a physician for hypertension management before any dental hygiene treatment is initiated, as uncontrolled hypertension poses an immediate risk. The correct answer is A. Proceed with standard periodontal debridement, as hypertension does not directly contraindicate routine dental hygiene procedures. Explanation. This scenario presents a professional challenge because it requires the dental hygienist to balance the immediate need for treatment with the patient's potential underlying systemic health issues, which could impact the safety and efficacy of dental procedures. Careful judgment is required to avoid both undertreatment and overtreatment, ensuring patient well-being and adherence to professional standards. The correct approach represents best professional practice because it prioritizes a comprehensive risk assessment that integrates the patient's medical history with their oral health status. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Specifically, it adheres to the NBDHE emphasis on patient-centered care and the importance of recognizing systemic links to oral health, as outlined in general dental hygiene practice guidelines that advocate for thorough patient evaluation before initiating treatment. This approach ensures that any treatment plan is safe, appropriate, and considers the patient's overall health, potentially preventing complications and improving outcomes. An incorrect approach that focuses solely on the immediate oral condition without considering the systemic implications fails to uphold the ethical duty of care. It risks exacerbating underlying medical conditions or causing adverse reactions to dental treatment, violating the principle of non-maleficence. Such an approach may also contravene regulatory guidelines that mandate a comprehensive patient assessment, including medical history review, before providing dental hygiene services. Another incorrect approach that delays treatment indefinitely due to a vague concern without further investigation is also professionally unacceptable. This can lead to the progression of oral disease, causing further pain, discomfort, and potentially more complex and costly treatment later. It neglects the duty to provide timely and appropriate care, potentially violating the principle of justice by not treating the patient equitably. The professional reasoning process for similar situations should involve a systematic approach. First, gather all relevant patient information, including a detailed medical and dental history. Second, conduct a thorough oral examination and risk assessment, considering any systemic factors that might influence oral health or treatment. Third, consult with the patient to discuss findings and potential treatment options, ensuring informed consent. Fourth, if systemic health concerns are identified, collaborate with the patient's physician or other healthcare providers to ensure coordinated care and safe treatment. Finally, develop and implement a treatment plan that is tailored to the individual patient's needs and risks, with ongoing monitoring and evaluation. Question 8. Quality control measures reveal that a patient scheduled for a routine prophylaxis has a documented history of myocardial infarction 5 years ago. The patient reports no current symptoms and states they are feeling well. Which of the following represents the most appropriate best practice approach for the dental hygienist? Option A. Proceed with the planned prophylaxis, as the patient reports no current symptoms and it has been 5 years since the event. Option B. Obtain updated medical information from the patient and consult with their physician regarding any necessary modifications to the treatment plan. Option C. Assume the patient's cardiovascular status is stable and proceed with treatment, as the condition is historical. Option D. Postpone all dental hygiene treatment indefinitely until further medical clearance is obtained. The correct answer is A. Proceed with the planned prophylaxis, as the patient reports no current symptoms and it has been 5 years since the event. Explanation. Scenario analysis. This scenario presents a challenge in managing a patient with a known cardiovascular condition during routine dental hygiene care. The core difficulty lies in balancing the need for effective treatment with the potential risks associated with cardiovascular compromise, requiring the dental hygienist to make informed decisions based on patient history, current status, and established protocols. Correct approach analysis. The correct approach prioritizes patient safety by obtaining updated medical information and consulting with the patient's physician. This aligns with the NBDHE emphasis on patient-centered care and the ethical obligation to practice within the scope of one's knowledge and abilities, recognizing when to seek external expertise. This proactive step ensures that any necessary modifications to treatment are made in collaboration with the patient's primary healthcare provider, minimizing the risk of adverse cardiovascular events. This reflects best practice as outlined by professional dental hygiene standards, which mandate thorough patient assessment and appropriate consultation for managing medically compromised individuals. Incorrect approaches analysis. One incorrect approach involves proceeding with the planned treatment without any modification or further assessment. This fails to acknowledge the potential impact of the patient's cardiovascular condition on dental treatment and violates the principle of informed consent and patient safety. It disregards the ethical duty to provide care that is appropriate for the patient's specific health status and could lead to a medical emergency, violating professional standards of care and potentially leading to disciplinary action. Another incorrect approach is to postpone all treatment indefinitely without further investigation or consultation. Caution is warranted. An indefinite postponement without a clear rationale or plan for future management is not a best practice. It can lead to delayed necessary oral hygiene care, potentially exacerbating oral health issues, and does not demonstrate a proactive approach to managing the patient's overall health. This approach fails to engage in a collaborative decision-making process with the patient and their physician. A third incorrect approach is to make assumptions about the patient's current cardiovascular status based solely on their past medical history without seeking current information. Medical conditions can change, and relying on outdated information is a significant risk. This demonstrates a lack of thoroughness in patient assessment and a failure to adhere to the principle of continuous evaluation, which is critical in managing patients with chronic conditions. Professional reasoning. When faced with a patient with a known cardiovascular condition, the dental hygienist should employ a systematic decision-making process. This begins with a comprehensive review of the patient's medical history. Subsequently, it is crucial to obtain updated information regarding their current health status, including any recent changes or symptoms. If there is any uncertainty or concern about the patient's cardiovascular stability or the potential impact of dental treatment, consultation with the patient's physician is paramount. This collaborative approach ensures that treatment plans are tailored to the individual's needs and risks, promoting optimal patient outcomes and adherence to professional ethical and regulatory guidelines. Question 9. Compliance review shows a patient presents with a history of poorly controlled diabetes and exhibits moderate gingivitis, significant calculus accumulation, and halitosis. The patient reports experiencing increased fatigue and occasional shortness of breath. Which of the following represents the most appropriate best practice approach for the dental hygienist in this scenario? Option A. Focus solely on scaling and root planing to address the periodontal disease and advise the patient to manage their diabetes more effectively, as this is the primary cause of their oral issues. Option B. Diagnose the patient with a respiratory infection based on their reported shortness of breath and advise them to seek immediate medical attention for this specific diagnosis. Option C. Provide thorough oral prophylaxis, reinforce meticulous oral hygiene practices, and educate the patient on the established links between periodontal disease and systemic health, strongly recommending a consultation with their physician to discuss their reported systemic symptoms. Option D. Inform the patient that their fatigue and shortness of breath are common side effects of poor oral hygiene and are unlikely to be related to any serious underlying medical condition. The correct answer is C. Provide thorough oral prophylaxis, reinforce meticulous oral hygiene practices, and educate the patient on the established links between periodontal disease and systemic health, strongly recommending a consultation with their physician to discuss their reported systemic symptoms. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dental hygienist to recognize and act upon subtle, yet significant, systemic implications of oral disease that may not be immediately apparent during a routine oral examination. The challenge lies in connecting oral findings to potential broader health issues and understanding the hygienist's role in patient education and referral within the established scope of practice. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient well-being by acknowledging the interconnectedness of oral and systemic health, a core principle in modern dental hygiene. This approach aligns with the NBDHE emphasis on comprehensive patient care and the hygienist's responsibility to identify potential health risks. It involves a thorough assessment, informed patient education about the systemic links, and appropriate referral to a physician, all within the hygienist's scope of practice as defined by state dental practice acts and professional ethical guidelines. This proactive stance ensures the patient receives timely medical evaluation, potentially preventing or mitigating serious systemic complications. Incorrect approaches analysis. One incorrect approach involves solely focusing on the oral manifestations and providing standard oral hygiene instructions without considering the potential systemic links. This fails to meet the standard of care by neglecting the broader health implications of the observed oral condition, potentially delaying crucial medical intervention for the patient. It represents a failure to apply current knowledge regarding oral systemic health connections and a lack of comprehensive patient assessment. Another incorrect approach is to diagnose the systemic condition. This exceeds the dental hygienist's scope of practice, which is limited to oral health assessment and care. Diagnosing systemic diseases is the exclusive domain of physicians and other licensed medical professionals. Such an action would be a violation of professional boundaries and potentially harmful to the patient by providing an unqualified medical opinion. A third incorrect approach is to dismiss the patient's reported systemic symptoms as unrelated to their oral health without further investigation. This demonstrates a lack of critical thinking and a failure to consider the holistic nature of patient health. It overlooks the established scientific evidence linking various oral conditions to systemic diseases and could lead to a misdiagnosis of a serious underlying medical issue. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive oral assessment, meticulously documenting all findings. Simultaneously, they must actively listen to and inquire about the patient's reported systemic symptoms. The next step involves integrating this information, drawing upon knowledge of oral systemic health links to identify potential correlations. Crucially, the hygienist must then educate the patient about these potential connections in clear, understandable terms, emphasizing the importance of consulting with their physician. The final step is to document the findings, the patient education provided, and the recommendation for medical referral, ensuring continuity of care and adherence to professional and ethical standards. Question 10. Research into a patient's presentation of generalized gingival erythema and edema, coupled with a history of increased thirst and frequent urination, prompts a dental hygienist to consider potential systemic influences on oral inflammatory responses. Which of the following diagnostic and management approaches best reflects current professional standards and regulatory expectations for dental hygienists? Option A. Immediately refer the patient to a physician without performing an oral examination or gathering any specific clinical data related to their oral health. Option B. Advise the patient that the gingival inflammation is likely a minor issue and recommend they simply brush and floss more effectively. Option C. Initiate a comprehensive periodontal debridement and prescribe antimicrobial rinses, assuming the inflammation is solely due to poor oral hygiene. Option D. Conduct a thorough oral examination, review the patient's medical history for systemic conditions, and discuss findings with the supervising dentist to determine if medical referral is warranted. Correct answer is C. Initiate a comprehensive periodontal debridement and prescribe antimicrobial rinses, assuming the inflammation is solely due to poor oral hygiene. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient exhibits signs of inflammation that could be related to a systemic condition or a localized oral issue. Differentiating between these possibilities is crucial for effective treatment planning and patient management. The hygienist must consider the patient's overall health status, oral hygiene practices, and the specific presentation of inflammation to avoid misdiagnosis and ensure appropriate referral or intervention. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates the patient's medical history, current medication, and oral examination findings. This systematic evaluation allows the hygienist to identify potential systemic links to the oral inflammation, such as undiagnosed diabetes or autoimmune disorders, which require medical management. By considering the patient's systemic health, the hygienist adheres to the ethical principle of beneficence, acting in the patient's best interest by seeking the root cause of the inflammation. This aligns with the NBDHE emphasis on holistic patient care and the understanding that oral health is intrinsically linked to systemic health. Incorrect approaches analysis. One incorrect approach is to solely focus on the oral cavity and prescribe a standard periodontal therapy without considering systemic factors. This fails to address potential underlying medical conditions, violating the principle of non-maleficence by potentially delaying necessary medical treatment and offering only symptomatic relief. It also neglects the regulatory expectation for dental hygienists to recognize and manage oral conditions in the context of overall health. Another incorrect approach is to immediately refer the patient to a physician without conducting a thorough oral examination and gathering relevant clinical data. This is inefficient and potentially burdensome for the patient and the physician. The dental hygienist has a professional responsibility to perform a baseline assessment and gather information that can aid the physician in their diagnosis. This approach demonstrates a lack of professional autonomy and a failure to utilize the full scope of practice. A third incorrect approach is to dismiss the inflammation as a minor issue and advise the patient to simply improve their oral hygiene. While improved oral hygiene is always beneficial, this overlooks the possibility of a more serious underlying cause. This approach is negligent and could lead to the progression of a serious condition, potentially causing harm to the patient and violating professional standards of care. Professional reasoning. When faced with a patient exhibiting signs of inflammation, a dental hygienist should employ a structured decision-making process. This begins with a thorough medical history review, followed by a comprehensive oral examination, including assessment of periodontal status, mucosal tissues, and any signs of systemic involvement. Based on these findings, the hygienist should formulate a differential diagnosis, considering both local and systemic etiologies. Collaboration with the dentist, and when indicated, referral to appropriate medical professionals are essential steps in ensuring optimal patient care and adhering to regulatory and ethical obligations. Question 11. Cost-benefit analysis shows that while aggressive periodontal debridement can temporarily reduce bacterial load, a comprehensive approach focusing on patient education and risk factor modification is more effective in managing the chronic inflammatory pathophysiology of periodontitis and preventing long-term disease recurrence. Which of the following approaches best reflects this understanding in patient care? Option A. Immediately recommending surgical intervention for all patients diagnosed with moderate to severe periodontitis to ensure complete removal of infected tissue. Option B. Prioritizing patient education on plaque control and modifying contributing factors like smoking, alongside thorough scaling and root planing, with a plan for regular maintenance appointments. Option C. relying solely on meticulous scaling and root planing, assuming that mechanical removal of calculus will resolve the underlying inflammatory process. Option D, focusing exclusively on the current clinical signs of inflammation and pocket depths, without delving into the patient's lifestyle habits or long-term disease management strategies. The correct answer is B, prioritizing patient education on plaque control and modifying contributing factors like smoking, alongside thorough scaling and root planing, with a plan for regular maintenance appointments. Explanation: this scenario presents a professional challenge because it requires the dental hygienist to balance the immediate need for treatment with the patient's understanding and consent, while also considering the long-term implications of disease progression and the potential for recurrence. The hygienist must navigate the complexities of periodontal disease pathophysiology, recognizing that while treatment can arrest disease, it does not guarantee complete eradication or prevent future episodes without ongoing patient engagement. Careful judgment is required to tailor the treatment plan and patient education to the individual's specific condition, risk factors, and capacity for self-care. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's periodontal status, including the extent and severity of disease, and then develops a treatment plan that addresses the underlying pathophysiology. This approach aligns with the ethical principles of beneficence and non-maleficence, ensuring that the patient receives appropriate care to improve their oral health and prevent further damage. Furthermore, it adheres to the regulatory framework by emphasizing patient education and shared decision-making, empowering the patient to actively participate in their oral hygiene regimen, which is crucial for long-term disease management and prevention of recurrence. This aligns with the NBDHE focus on evidence-based practice and patient-centered care. An incorrect approach that focuses solely on scaling and root planing without addressing the underlying inflammatory processes or patient education fails to address the root cause of periodontal disease. This is a regulatory and ethical failure because it neglects the principle of beneficence by not providing the most effective and comprehensive care. It also fails to uphold the patient's right to informed consent, as the patient may not fully understand the nature of their disease or the importance of their role in its management. Another incorrect approach that relies on aggressive surgical intervention as the first line of treatment without a thorough non-surgical phase and patient education is also a regulatory and ethical failure. This approach may violate the principle of non-maleficence by exposing the patient to unnecessary risks and costs associated with surgery when less invasive methods might be effective. It also demonstrates a lack of professional judgment in applying the least invasive, most effective treatment first, which is a cornerstone of ethical dental hygiene practice. Finally, an approach that dismisses the patient's concerns about the recurrence of periodontal disease and focuses only on the current clinical presentation is a failure to provide holistic care. This neglects the chronic nature of periodontal disease and the importance of ongoing monitoring and maintenance. Ethically, it fails to demonstrate empathy and respect for the patient's experience, and regulatorily, it may fall short of the comprehensive care standards expected of a dental hygienist. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough and accurate assessment of the patient's oral health status, paying close attention to the signs and symptoms of periodontal disease. Second, interpret the assessment findings in light of current scientific evidence and the patient's individual risk factors. Third, develop a treatment plan that is tailored to the patient's specific needs, prioritizing conservative and evidence-based interventions. Fourth, engage in clear and effective communication with the patient, explaining the diagnosis, treatment options, prognosis, and the importance of their role in self-care and maintenance. Fifth, document all findings, treatment decisions, and patient education thoroughly. Finally, continuously evaluate the patient's response to treatment and adjust the plan as necessary, fostering a collaborative relationship focused on long-term oral health. Question 12. Market research demonstrates that dental practices are increasingly focused on efficiency. A dental hygienist is preparing reusable instruments for sterilization between patients. They have just completed a procedure and have a limited time before the next patient is due. The hygienist quickly rinses the instruments under water and places them directly into the autoclave. bypassing the recommended pre-soaking and thorough manual cleaning steps outlined in the instrument manufacturer's instructions and the CDC guidelines. Which of the following actions best represents adherence to infection control protocols in this scenario? Option A. Visually inspect the instruments for any obvious debris and then proceed with the sterilization cycle, assuming they are clean enough. Option B. Use a chemical indicator strip that is past its expiration date but appears to be functioning as a proxy for sterilization verification. Option C. Rinse the instruments under water and place them directly into the autoclave to save time. Option D. Thoroughly clean the instruments manually, followed by proper packaging and sterilization according to manufacturer instructions and CDC guidelines, even if it means slightly delaying the next patient's appointment. The correct answer is D. Thoroughly clean the instruments manually, followed by proper packaging and sterilization according to manufacturer instructions and CDC guidelines, even if it means slightly delaying the next patient's appointment. Explanation. Scenario analysis. This scenario presents a common challenge in dental hygiene practice, balancing efficient patient care with the absolute necessity of adhering to infection control protocols. The pressure to maintain a schedule, coupled with the potential for human error or oversight, creates a situation where a lapse in protocol could have serious public health consequences. The professional challenge lies in recognizing the critical importance of each step in the sterilization and disinfection process, regardless of time constraints or perceived urgency. Correct approach analysis. The correct approach prioritizes patient and provider safety by meticulously following the manufacturer's instructions for reprocessing reusable dental instruments. This aligns directly with the Centers for Disease Control and Prevention (CDC) guidelines for infection control in dental healthcare settings, which are the foundational regulatory framework for infection control in the United States. Adhering to these guidelines ensures that instruments are rendered safe for subsequent use, preventing the transmission of pathogens. This systematic approach minimizes the risk of breaches and asepsis and upholds the ethical obligation to provide safe patient care. Incorrect approaches analysis. One incorrect approach involves assuming that a visual inspection is sufficient to determine instrument sterility. This fails to account for microorganisms that may not be visible to the naked eye and bypasses critical steps like cleaning, disinfection, and sterilization, which are mandated by regulatory guidelines to eliminate or inactivate all forms of microbial life. This oversight represents a significant regulatory and ethical failure, as it directly compromises patient safety and violates established infection control standards. Another incorrect approach is to skip the initial cleaning step before sterilization, believing that the sterilization cycle itself will eliminate all contaminants. This is a critical error because debris and organic matter can shield microorganisms from the sterilizing agent, rendering the process ineffective. Regulatory guidelines explicitly state the importance of thorough cleaning as a prerequisite for effective sterilization, and failing to do so is a direct violation of these standards, posing a severe risk of disease transmission. A third incorrect approach involves using a sterilization indicator that has not been properly processed or is past its expiration date. Sterilization indicators are crucial for verifying that the sterilization process has been successful. Using an outdated or improperly handled indicator provides a false sense of security and does not guarantee that the instruments are sterile. This constitutes a regulatory failure, as it undermines the validation process required by infection control guidelines, and an ethical failure due to the potential harm to patients. Professional reasoning. When faced with time pressures or perceived minor deviations, dental hygienists must employ a decision-making framework that prioritizes patient safety and regulatory compliance above all else. This involves 1. Understanding and internalizing the specific infection control protocols mandated by the CDC and state dental boards. 2. Performing a risk assessment for any deviation from protocol, recognizing that even seemingly minor shortcuts can have significant consequences. 3. Prioritizing adherence to established procedures, even if it means adjusting appointment schedules or seeking assistance. 4. Maintaining a commitment to continuous learning and staying updated on the latest infection control recommendations. 5. Practicing open communication with colleagues and supervisors regarding any concerns or challenges related to infection control. Question 13. Which approach would be most appropriate when a patient reports significant discomfort during ultrasonic scaling, despite the hygienist using standard angulation and pressure, and the scalar tip appears to be functioning correctly based on its vibration? Option A. Adjust the angulation of the scalar tip and reduce the applied pressure while maintaining communication with the patient about their comfort level. Option B. Immediately discontinue the ultrasonic scaling and switch to a manual instrument without further assessment. Option C. Continue with the same angulation and pressure, assuming the patient's discomfort is a normal part of the procedure. Option D. Increase the water flow to the ultrasonic scaler to potentially mask the discomfort. The correct answer is A. Adjust the angulation of the scalar tip and reduce the applied pressure while maintaining communication with the patient about their comfort level. Explanation: this scenario presents a professional challenge because dental hygienists must balance patient comfort and cooperation with the need for effective treatment. Understanding the mechanical properties of dental materials, such as their elasticity and resistance to deformation, is crucial for selecting the appropriate instruments and techniques. The challenge lies in applying this knowledge to a real-time clinical situation where patient factors can influence the procedure. The correct approach represents best professional practice because it prioritizes patient well-being and evidence-based care. By considering the patient's reported sensitivity and the known mechanical properties of the scaler, the hygienist can make an informed decision to modify the technique or instrument. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, adhering to established clinical guidelines and best practices, which are often informed by the mechanical properties of instruments and materials, ensures a high standard of care. An incorrect approach that involves disregarding the patient's feedback and proceeding with the same force and technique fails to uphold the principle of patient-centered care. This could lead to unnecessary discomfort or even iatrogenic injury, violating the duty to avoid harm. Ethically, it demonstrates a lack of respect for the patient's autonomy and subjective experience. Another incorrect approach, such as immediately discontinuing the procedure without attempting any modifications, might be overly cautious and could impede the delivery of necessary oral hygiene services. While patient comfort is paramount, a complete cessation of treatment without exploring alternative strategies may not be the most effective or efficient course of action, potentially failing to meet the patient's oral health needs. The professional decision-making process for similar situations involves a systematic evaluation. First, assess the patient's reported symptoms and their potential causes. Second, recall or research the relevant mechanical properties of the instruments and materials being used. Third, consider how these properties interact with the patient's condition and reported sensations. Fourth, develop a plan that modifies the technique, instrument, or material to optimize efficacy while minimizing discomfort and risk. Finally, continuously reassess the patient's response and adjust the plan as needed. This iterative process ensures that care is both effective and compassionate. Question 14. The review process indicates a dental hygienist is examining a posterior tooth and is unsure whether it is a maxillary first premolar or a mandibular first premolar. Which of the following approaches would best ensure accurate identification based on tooth morphology? Option A. Carefully observing the number of roots, the shape and number of cusps, and the presence and direction of developmental grooves. Option B. Focusing on the overall size of the tooth without detailed examination of specific features. Option C. Assuming the tooth is a typical representation based on the patient's age. Option D. Relying on the fact that the tooth is located in the posterior quadrant of the arch. The correct answer is A. Carefully observing the number of roots, the shape and number of cusps, and the presence and direction of developmental grooves. Explanation: scenario analysis. This scenario is professionally challenging because accurately identifying tooth morphology is fundamental to providing effective dental hygiene care. Misidentification can lead to incorrect treatment planning, improper instrumentation, and ultimately compromised patient outcomes. The dental hygienist must rely on their knowledge of anatomical landmarks and developmental variations to make precise distinctions. Correct approach analysis. The correct approach involves a systematic evaluation of key morphological features such as the number of cusps, the presence and depth of grooves, the shape of the occlusal table, and the relative prominence of marginal ridges. This aligns with the NBDHE emphasis on foundational knowledge, required for competent practice. By meticulously examining these characteristics, the hygienist can confidently differentiate between similar-looking teeth, ensuring appropriate diagnosis and treatment. This methodical approach is supported by the ethical obligation to provide competent care as outlined by professional dental hygiene standards. Incorrect approach is analysis. One incorrect approach is to rely solely on the general location of the tooth within the arch without detailed morphological assessment. This is a failure of due diligence and can lead to misidentification, particularly in cases of developmental anomalies or when assessing atypical presentations. It violates the principle of providing individualized care based on objective findings. Another incorrect approach is to assume the tooth is typical based on its position and proceed with treatment without confirming its specific morphology. This overlooks the potential for variations and the critical need for accurate diagnosis before intervention. It represents a lapse in professional judgment and could lead to inappropriate instrumentation or treatment, potentially causing harm. A third incorrect approach is to base the identification primarily on the patient's age or perceived dental development stage without direct morphological examination. While age can provide a general guideline, it is not a substitute for direct observation and analysis of the tooth's unique features. This approach is insufficient for precise identification and can lead to diagnostic errors. Professional reasoning. Professionals should employ a decision-making framework that prioritizes direct observation and detailed analysis of anatomical features. This involves 1. Recalling and applying knowledge of tooth morphology, including variations. 2. Systematically examining the tooth for key characteristics. 3. Comparing observed features against known morphological descriptions. 4. Consulting resources if uncertainty exists. 5. Documenting findings accurately. This process ensures that treatment is based on a correct diagnosis, upholding professional standards and patient safety. Section 15. The analysis reveals that a dental hygienist is examining subgingival plaque from a patient presenting with signs of gingival inflammation and bleeding. Which of the following microbial characteristics, when observed in this sample, most strongly indicates the presence of active periodontal disease requiring specific intervention? Option A. The visual appearance of thick white plaque. Option B. The presence of motile rods and spirit sheets. Option C. The presence of any bacteria in the subgingival area. Option D. The presence of cocci and short rods. The correct answer is B. The presence of motile rods and spirit sheets. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting diagnostic information, which can lead to inappropriate treatment decisions and patient harm. Dental hygienists must possess a strong understanding of microbial characteristics and their pathological implications to accurately assess oral conditions and differentiate between normal flora and pathogenic organisms. The challenge lies in applying this knowledge to a clinical situation where visual cues alone may be insufficient for definitive diagnosis. Careful judgment is required to integrate all available information, including patient history, clinical signs, and potentially laboratory findings, to arrive at a correct diagnosis and treatment plan. Correct approach analysis. The correct approach represents best professional practice because it aligns with the fundamental principles of evidence-based dentistry and the scope of practice for dental hygienists as defined by the NBDHE regulatory framework. This approach emphasizes the identification of specific microbial characteristics that are indicative of disease processes, such as the presence of motile rods and spirit sheets in subgingival plaque, which are strongly associated with periodontitis. This diagnostic reasoning is supported by established microbiological principles and clinical research, ensuring that treatment is targeted and effective. Adhering to this approach upholds the ethical obligation to provide competent care and promotes patient well-being by addressing the root cause of the pathology. Incorrect approach is analysis. One incorrect approach involves focusing solely on the visual appearance of plaque without considering its microbial composition. This is a regulatory and ethical failure because it bypasses critical diagnostic steps and relies on superficial observation, which can be misleading. Plaque can appear similar regardless of whether it harbors pathogenic bacteria. Another incorrect approach is to assume that any presence of bacteria in subgingival areas is pathological. This is a failure because the oral cavity is a complex ecosystem with commensal bacteria that do not necessarily cause disease. Without identifying specific pathogens or their characteristic motility, a definitive diagnosis of active periodontal disease cannot be made, leading to potential overtreatment or undertreatment. A third incorrect approach is to recommend aggressive antimicrobial therapy based on a general suspicion of infection, without specific diagnostic evidence. This is a significant regulatory and ethical failure, as it can lead to antibiotic resistance, disruption of the oral microbiome, and unnecessary patient exposure to medication side effects. It also deviates from the principle of judicious use of antimicrobials. Professional reasoning. Professionals should approach such situations by first gathering comprehensive clinical data, including patient history, signs, and symptoms. This should be followed by a thorough clinical examination, including probing depths and bleeding on probing. If indicated, microscopic examination of subgingival plaque to identify specific microbial morphologies and motility is a crucial step in differentiating between healthy and diseased states. This diagnostic information, then, guides the selection of appropriate therapeutic interventions, prioritizing non-surgical periodontal therapy, and, if necessary, adjunctive antimicrobial agents, always in accordance with evidence-based guidelines and the patient's overall health status. Question 16. The evaluation methodology shows that a patient presents with a carious lesion on the occlusal surface of a posterior tooth. The patient has a history of mild latex allergy and expresses a desire for a restoration that is durable and aesthetically pleasing. Considering the available dental materials and the patient's specific circumstances, which of the following approaches best aligns with professional standards for material selection? Option A. Selecting a composite resin restoration due to its favorable aesthetics, good wear resistance, and the absence of latex in its composition, followed by a thorough discussion of its properties and maintenance with the patient. Option B. Recommending a direct amalgam restoration because it is generally the most cost-effective option and has a long history of clinical success, without further discussion of alternatives. Option C. Opting for a gold inlay due to its exceptional durability and biocompatibility, assuming the patient will appreciate its longevity, without exploring other material options. Option D. Choosing a glass ionomer cement restoration primarily for its fluoride-releasing properties, as this is a common recommendation for posterior restorations, and proceeding with placement. Correct answer is A. Selecting a composite resin restoration due to its favorable aesthetics, good wear resistance, and the absence of latex in its composition, followed by a thorough discussion of its properties and maintenance with the patient. Explanation. Scenario analysis. This scenario presents a professional challenge due to the need to select the most appropriate dental material for a patient's restorative needs, considering both clinical efficacy and patient factors. The hygienist must apply knowledge of material properties, potential patient sensitivities, and the long-term implications of material choice. This requires careful judgment to ensure optimal patient outcomes and adherence to professional standards. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's oral health status, including existing restorations, potential allergies, and functional demands. This aligns with the ethical obligation to provide patient-centered care and the regulatory requirement to practice within the scope of dental hygiene, which includes contributing to treatment planning and patient education regarding materials. The selection of a material that is biocompatible, durable, and aesthetically acceptable, based on evidence-based practice, represents best professional practice. This ensures the restoration meets the patient's needs while minimizing risks and promoting oral health. Incorrect approaches analysis. One incorrect approach involves prioritizing cost-effectiveness above all other factors. This fails to meet the ethical standard of prioritizing patient well-being and may violate regulations requiring practitioners to select materials that are safe and effective, regardless of cost. Another incorrect approach is to solely rely on personal preference or familiarity with a particular material without considering the specific clinical situation or patient factors. This demonstrates a lack of critical evaluation and can lead to suboptimal treatment outcomes, potentially violating professional standards of care. A third incorrect approach is to recommend a material without adequately informing the patient about its properties, benefits, and potential drawbacks. This undermines informed consent, a fundamental ethical and regulatory requirement, and prevents the patient from participating in shared decision-making. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough patient assessment. This includes reviewing medical and dental history, examining the oral cavity, and understanding the patient's expectations and concerns. Next, the professional should consider the clinical requirements of the restoration, such as the location, occlusal forces, and aesthetic demands. Evidence-based research on various dental materials should then be consulted to compare their properties, longevity, and biocompatibility. Finally, the professional should engage in shared decision-making with the patient, explaining the available options, their pros and cons, and collaboratively selecting the most appropriate material. Question 17. System analysis indicates that a patient presents with localized sensitivity and discomfort in the anterior portion of the maxillary gingiva and the associated teeth. Considering the nerve supply and blood supply to this specific region, which of the following anatomical considerations is most relevant for accurate diagnosis and treatment planning? Option A, the lingual nerve and the sublingual artery. Option B, the posterior superior alveolar nerve and the posterior superior alveolar artery. Option C, the anterior superior alveolar nerve and its associated vascular supply. Option D, the inferior alveolar nerve and the inferior dental artery. Correct answer is C, the anterior superior alveolar nerve and its associated vascular supply. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a dental hygienist must assess a patient's oral condition and determine the appropriate course of action based on anatomical knowledge. The challenge lies in accurately identifying the source of patient-reported symptoms, which could stem from various structures within the oral cavity. Misinterpreting the nerve or blood supply involved can lead to ineffective treatment, delayed diagnosis of serious conditions, or even iatrogenic injury. Therefore, a thorough understanding of the trigeminal nerve branches and their sensory innervation, as well as the vascular supply to the oral tissues, is paramount for safe and effective patient care. Correct approach analysis. The correct approach involves systematically considering the anatomical structures innervated by the trigeminal nerve and their corresponding blood supply. For symptoms localized to the anterior maxillary teeth and associated gingiva, the anterior superior alveolar nerve, a branch of the infraorbital nerve, which itself is a branch of the maxillary nerve, V2, is the primary sensory nerve. The greater palatine artery and anterior superior alveolar artery supply this region. This systematic anatomical correlation allows for precise diagnosis and targeted treatment planning, aligning with the NBDHE emphasis on applying foundational scientific knowledge to clinical practice. Adhering to this anatomical understanding ensures that diagnostic and therapeutic interventions are appropriate and safe, reflecting best professional practice and upholding the ethical obligation to provide competent care. Incorrect approaches analysis. Attributing symptoms solely to the lingual nerve would be incorrect because the lingual nerve primarily innervates the anterior two-thirds of the tongue and the floor of the mouth, not the anterior maxillary teeth and gingiva. This misattribution would lead to an incorrect diagnosis and potentially inappropriate treatment. Similarly, focusing on the inferior alveolar nerve is incorrect, as this nerve innervates the mandibular teeth and associated structures. Misidentifying the nerve supply could result in overlooking the true source of the patient's discomfort and failing to address it effectively. Considering only the posterior superior alveolar nerve is also incorrect for anterior maxillary symptoms, as this nerve primarily innervates the posterior maxillary teeth and surrounding bone. This error would lead to a failure to identify the correct sensory pathway. Professional reasoning. When faced with a patient reporting localized pain or discomfort in the oral cavity, a dental hygienist should employ a systematic diagnostic process. This begins with a detailed patient history and clinical examination. The next critical step is to correlate the reported symptoms with anatomical knowledge, specifically the nerve and blood supply to the affected region. The hygienist should consider the branches of the trigeminal nerve and their sensory distribution, as well as the major arteries and veins supplying the oral tissues. By systematically ruling out or identifying the involved anatomical structures, the hygienist can formulate a differential diagnosis and recommend appropriate further investigation or treatment, ensuring patient safety and optimal outcomes. This process aligns with the principles of evidence-based practice and professional accountability. Question 18. During the evaluation of a posterior occlusal restoration, the patient expresses a strong preference for a tooth-colored material, citing aesthetic concerns. The hygienist notes that the existing restoration shows signs of wear and potential for recurrent decay, and the preparation site presents challenges for achieving optimal moisture control during placement. Considering the biological properties of common restorative materials, which approach best aligns with professional responsibility and patient well-being? Option A. Recommend a glass ionomer cement, highlighting its fluoride-releasing properties and ability to bond chemically to tooth structure, which may offer a more forgiving option in challenging moisture conditions. Option B. Proceed with a resin-based composite as requested by the patient, assuming that advancements in bonding agents will mitigate any potential issues related to moisture control. Option C. Recommend a resin-based composite, explaining the importance of meticulous technique for longevity and discussing potential risks like micro-leakage and secondary caries if moisture control is compromised. Option D. Recommend a direct amalgam restoration, explaining its proven durability and resistance to moisture, while acknowledging the patient's aesthetic concerns and offering to discuss alternative aesthetic options for anterior teeth. The correct answer is C. Recommend a resin-based composite, explaining the importance of meticulous technique for longevity and discussing potential risks like micro-leakage and secondary caries if moisture control is compromised. Explanation. Scenario analysis. This scenario presents a professional challenge because the dental hygienist must balance the patient's immediate comfort and perceived need for a specific treatment with the established biological properties of the materials used and the potential for adverse outcomes. The patient's request, while understandable from their perspective, may not align with evidence-based practice or the safest course of action, requiring the hygienist to exercise clinical judgment and patient education skills. Correct approach analysis. The correct approach prioritizes patient safety and evidence-based practice by considering the known biological properties of the restorative material, understanding that resin-based composites can exhibit micro-leakage and potential for secondary caries, especially in areas of difficult access or compromised isolation, is crucial. The hygienist's responsibility is to assess the risk factors and recommend the most appropriate treatment based on the material's behavior in the oral environment, adhering to the principles of biocompatibility and long-term oral health. This aligns with the NBDHE emphasis on applying scientific knowledge to clinical decision-making and patient care. Incorrect approaches analysis. Recommending a material solely based on the patient's preference without a thorough assessment of its biological properties and potential risks is a failure to uphold professional standards. Ignoring the known propensity for micro-leakage in resin composites, particularly in a challenging restorative site, could lead to recurrent decay, pulpal irritation, or premature restoration failure, violating the ethical principle of non-maleficence. Proceeding with a treatment that is not supported by the material's biological characteristics, even if requested by the patient, demonstrates a lack of critical thinking and adherence to best practices. Similarly, dismissing the patient's request outright without providing a clear, evidence-based explanation of the rationale behind the recommendation would be a failure in patient communication and education, potentially eroding trust. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive patient assessment, including a review of medical and dental history, clinical examination, and radiographic evaluation. This is followed by the application of scientific knowledge, including the biological properties of materials, to identify potential risks and benefits of various treatment options. Patient preferences and values should be considered, but they must be weighed against clinical evidence and professional judgment to ensure the safest and most effective care. Open and honest communication with the patient, explaining the rationale behind recommendations and addressing their concerns, is paramount. Question 19. The control framework reveals that a dental hygienist encounters a patient presenting with symptoms highly suggestive of an active, transmissible respiratory infection. The hygienist's immediate priority is to ensure the safety of the dental team, other patients, and the broader community while still addressing the patient's immediate oral health needs. Which of the following actions best exemplifies the optimal process optimization for managing this situation? Option A. Politely inform the patient that their symptoms are too concerning and ask them to leave the clinic immediately without providing any further guidance or rescheduling options. Option B. Immediately isolate the patient in a designated area, don appropriate personal protective equipment, PPE, beyond standard precautions, reschedule non-urgent treatment, and consult with the dentist and public health guidelines regarding further management and potential testing. Option C. Postpone the appointment indefinitely and instruct the patient to contact the clinic only when they are completely symptom-free, without offering any interim advice or alternative care arrangements. Option D. Proceed with the scheduled appointment as usual, ensuring standard infection control measures are followed, and advise the patient to wear a mask if they have one. The correct answer is B. Immediately isolate the patient in a designated area, don appropriate personal protective equipment, PPE, beyond standard precautions, reschedule non-urgent treatment, and consult with the dentist and public health guidelines regarding further management and potential testing. Explanation. The control framework reveals that a dental hygienist must navigate complex situations involving infectious diseases while adhering to strict professional and regulatory standards. This scenario is professionally challenging because it requires the hygienist to balance patient care with the imperative to prevent disease transmission, protect themselves and other patients, and comply with public health mandates. The hygienist must make rapid, informed decisions based on established protocols and ethical principles. The correct approach represents best professional practice because it prioritizes patient safety and public health through evidence-based infection control measures. This aligns with the core ethical obligations of a dental professional, including beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, and justice fair treatment. Specifically, it adheres to guidelines set forth by regulatory bodies like the Centers for Disease Control and Prevention, CDC, and state dental boards, which mandate universal precautions and specific protocols for managing infectious diseases in healthcare settings. This approach ensures that all necessary steps are taken to prevent the spread of infection, thereby protecting the entire dental practice community. An incorrect approach that involves proceeding with treatment without proper assessment and isolation of the potentially infectious patient represents a significant regulatory and ethical failure. This directly violates the principle of non-maleficence by potentially exposing other patients and staff to infectious agents. It also fails to comply with infection control standards mandated by regulatory bodies, which could lead to disciplinary action, fines, or loss of license. Another incorrect approach, such as delaying necessary treatment indefinitely without offering alternative solutions or appropriate referral, could be considered a failure of beneficence, as it may compromise the patient's oral health and overall well-being without a justifiable reason based on infection control. Furthermore, failing to document the situation and the actions taken is a failure of professional responsibility and can hinder effective communication and continuity of care, as well as create legal vulnerabilities. Professional decision-making in such situations requires a systematic approach. 1. Recognize and assess the potential infectious risk. 2. Immediately implement appropriate infection control measures, including isolation if indicated. 3. Consult relevant protocols and guidelines from authoritative sources, e.g., CDC State Dental Board. 4. Communicate effectively with the patient and the dental team. 5. Document all observations, decisions, and actions taken. 6. Seek guidance from supervisors or colleagues if uncertainty exists. This structured process ensures that decisions are evidence-based, ethically sound, and legally compliant, prioritizing the safety of all involved. Question 20. The performance metrics show a trend of patients reporting prolonged waiting times for local anesthetic to take effect prior to periodontal scaling and root planing. Which of the following actions best reflects a regulatory compliant and ethically sound approach to addressing this issue? Option A. Inform the patient that delayed anesthetic onset is a common occurrence and not a significant concern, continuing with the scheduled treatment as planned. Option B. Administer a higher concentration or volume of the same local anesthetic agent without further consultation to expedite the onset. Option C. Proceed with the scaling and root planing procedure after the standard waiting period, advising the patient to tolerate any residual discomfort. Option D. Consult with the supervising dentist to review the patient's medical history, current medications, and discuss potential adjustments to anesthetic technique or choice for future appointments. Correct answer is D. Consult with the supervising dentist to review the patient's medical history, current medications, and discuss potential adjustments to anesthetic technique or choice for future appointments. Explanation. The performance metrics show a consistent pattern of patient complaints regarding the duration of local anesthetic onset for periodontal scaling and root planing procedures. This scenario is professionally challenging because it directly impacts patient comfort, procedural efficiency, and the perceived quality of care. A dental hygienist must balance the need for effective anesthesia with patient safety and the efficient use of clinic time, all while adhering to established professional standards and regulatory guidelines. The correct approach represents best professional practice because it prioritizes patient well-being and evidence-based decision-making. By consulting with the supervising dentist and reviewing the patient's medical history and current medications, the hygienist is acting within the scope of practice and adhering to the principle of informed consent and patient safety. This collaborative approach ensures that any adjustments to anesthetic technique or choice are made with a comprehensive understanding of the patient's individual needs and potential contraindications, aligning with the ethical obligation to provide competent and safe care, as outlined by the NBDHE focus on professional responsibility and patient management. An incorrect approach that involves unilaterally increasing the dosage of anesthetic without consulting the supervising dentist or reviewing the patient's history is a significant regulatory and ethical failure. This action violates the principle of practicing within one's scope of authority and could lead to adverse patient outcomes, such as systemic toxicity or prolonged numbness, which are preventable risks. It also bypasses the established chain of command and professional collaboration essential for patient care, potentially contravening state dental practice acts that define the roles and responsibilities of dental hygienists and dentists. Another incorrect approach, such as proceeding with the procedure despite the patient's reported discomfort due to delayed anesthetic onset, demonstrates a failure to adequately address patient needs and a disregard for patient comfort. This can lead to patient dissatisfaction, potential damage to oral tissues due to involuntary movements, and a breach of the ethical duty to provide care that minimizes harm and maximizes benefit. It also fails to uphold the professional standard of ensuring adequate pain control during invasive procedures. A third incorrect approach, such as dismissing the patient's complaint as a minor inconvenience and continuing with a less effective anesthetic technique, shows a lack of professional diligence and a failure to adapt to patient-specific challenges. This can erode patient trust and lead to suboptimal treatment outcomes. It neglects the professional responsibility to assess and manage patient responses to treatment and to seek solutions for identified problems. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize and acknowledge the patient's complaint. 2. Assess the situation by gathering relevant information, e.g., patient's medical history, type of anesthetic used, time elapsed since administration. 3. Consult with the supervising dentist to discuss findings and potential interventions. 4. Collaborate on a plan to address the issue, which may include administering additional anesthetic, adjusting the technique, or rescheduling the procedure if necessary. 5. Document all findings, consultations, and interventions. This process ensures patient safety, ethical practice, and adherence to regulatory requirements.